Brutus. I'm going to talk about your elbow complex. Here, you've got three bones. You've got your humerus, your radius, your ulna. You've got three joints within the elbow complex: humero-ulnar, radiohumeral, and superior radio-ulnar. You've got different bony structures or characteristics, such as the medial epicondyle, the lateral epicondyle, coronate process, coronate fossa, trochlea, capitulum radial head, radial fossa inside the ulna, posteriorly olecranon process and olecranon fossa. And all these characteristics are because we need the greatest range of movement. So for example, you've got your coronate process into the coronate fossa, radial head into the radial fossa, allowing pronation, and olecranon process into the olecranon fossa. Three movements then. We've got flexion, extension, pronation, supination, and also let's not forget the carrying angle, because the radial head is shorter and it can compress a little bit into the joint. Other features we can talk about is synovial, obviously, and the capsule is shared with the superior radio-ulnar joint but has no direct attachment to radius. Synovial membrane lines with the annular ligament and the fossa, all the fossas, so the coronate, the radial, and olecranon fossas. We've got ligaments which blend with the capsule. So we've got the ulnar or medial collateral ligament on here, radial collateral ligament or lateral collateral ligament, and the annular ligament around the radial head. Let's talk about the ulnar ligament. So it's made of three parts around the medial epicondyle. The anterior part goes into the coronate process, posterior part goes from the medial epicondyle into the olecranon, and the transverse around all the medial part. And primarily the medial collateral ligament or ulnar ligament constrains valgus forces, as you see there. The anterior bundle will tilt from 0 to 60 degrees, and then the posterior part will go from 60 to 120. The transverse bundle will not, it has very minimal contribution to stability. The radial collateral ligament, triangular in shape, goes from the center of the lateral epicondyle and it blends into the annular ligament and onto the ulna. Primarily restrained posterolateral rotatory instability. So for example, it avoids like subluxations of the radial head. And finally, we've got the annular ligament around the radial head, as we said before. Is a thick ring, perhaps around the head of radius. Is lined with a synovial membrane and attaches to the radial notch. So we've got the quadrate ligament that comes from the lower border of the radial notch onto the ulna, and it does give some stability to the superior radio-ulnar joint. Other structures we could mention, it could be the olecranon bursa. Bursa, as its name indicates, is like a pocket of fluid and allows like smooth actions of muscles. It's quite superficial, and the name bursitis refers to inflammation of the bursa. Let's talk about the limits of movement. So we've got flexion, which actively achieves 140 degrees and passively 160 degrees. The limits to that movement, it would be the soft tissue from the biceps, tension from the posterior capsule, and tendons from the triceps coming from the back. Extension is 0 degrees and is limited by bony surfaces, like as we said before, the olecranon into the olecranon fossa, and also the tension from the anterior capsule, as well as anterior collateral ligaments. We talk about the carrying angle, didn't we? We can talk about the neurovascular structures around the elbow joint. So 3 main nerves: median nerve, radial nerve, ulnar nerve, blood supply, brachial artery, cubital vein. And we can talk about the cubital fossa, which is a triangle area similar to the popliteal fossa and femoral triangle. So we've got the borders, could be the epicondyles of the humerus superiorly, pronator teres medially, and brachioradialis laterally. Contents of the cubital fossa: so it's the biceps tendon inserting into the radial tuberosity, the brachial artery, and the medial nerve. That would go from lateral to medial. Then we've got the radial nerve, which lies on the lateral border of the fossa, the ulnar nerve, that will come posteromedially, and the medial cubital vein, which sits within the aponeurosis that forms the root of the fossa.